These are not guidelines, these are just ways in which a primary care provider might look at an issue. Today, I would like to discuss Sjogren's. And Sjogren's is an autoimmune disease in which the body attacks the exocrine glands, which are responsible for producing saliva and tears. And this will lead to symptoms that the patient will present to you with, and you would be the one who has the opportunity to catch this condition, and in that way helping the patient to avoid years of discomfort and suffering and probably damage to their organs. And basically, Sjogren's can lead to symptoms which that would be what the patient would present with, such as dry mouth, dry eyes, dry vagina, dry skin. They will also have poor dentition. They will have severe gingivitis. Many of them will have tooth loss at an early age. Some of them would present with tongue disorders such as sore tongue or discomfort in the tongue. Other people might present with very vague symptoms such as fatigue and joint pains, and other patients might present with coughing, difficulty swallowing, and this would be due to lack of saliva. And other patients might present with parotid gland swelling, and that occurs due to the destruction of the salivary gland, and that would cause changes in the parotid gland, such as inflammation and enlargement. But the main thing that I want you to remember is that anybody who complains of dry mouth, dry eyes, although there are many causes for these symptoms, such as medications and diabetes, which you also don't want to miss, but you do not want to miss Sjogren's syndrome or Sjogren's disease, because you would be the only one who might think about ruling it out. And it's very significant because this autoimmune condition can lead to severe organ damage, such as kidney damage and lung damage, but it also makes the patient 40 times more likely to have lymphoma. So in patients who have these symptoms, you might want to ask also, you want to ask and you want to assess for any lymphadenopathy. And how do we rule out Sjogren's syndrome? It's very simple. Is for the diagnosis to be given, it's more complicated, but your job is to make sure that you do autoimmune testing. You want to do an SSA antibody, which they call also raw, an SSB antibody, which they call also La. And these are the two tests that you would do in the blood, and you would see if it comes back positive. If it comes back positive, bingo, your job to that point is to send them to the rheumatologist. And if it is a female of pregnancy age, you want to make sure that you send them to the GYN so that they are aware of this, and they can be on the lookout for any, if the patient gets pregnant, they can keep an eye on any neonatal lupus or congenital heart block, which can occur with this condition. So basically, the patient comes with symptoms of dry mouth, dry eyes, which are very vague, fatigue sometimes. You do an SSA and SSB. If it comes back negative, just look for other causes and treat the symptoms. If it comes back positive, that's all you need. And then you send them to the rheumatologist, who is going to look into this more in depth, and you might have saved the patient years of suffering with fatigue and just dry mouth, dry discomfort, tongue discomfort, dry cough, and maybe nobody would think about doing this test, SSA and SSB, which are just blood tests, antibody tests that are done very easily. You just put the order in, and then you wait for the results to come back. Now, what is the treatment for Sjogren's symptoms? The rheumatologist would many times give hydroxychloroquine, and they would just completely do many tests to see if it's primary or secondary. If it's primary, it means it's just Sjogren's, the body's just attacking the glands. If it's secondary, they would find also lupus or rheumatoid arthritis, but that would be their doing. They also would do CAT scans probably of the abdomen and chest just to look for any lymphadenopathy. But your job on your end would be to tell the patients to drink lots and lots of water, eat sugarless gum, frequent dental visits, biotin mouthwash, eye lubricant. That's just to keep the saliva flowing, to make sure that there is less eye discomfort. But your main job would be anybody who complains of dry mouth, dry eyes, you order an SSA and SSB and wait for the results. And then you could tell them drink lots and lots of water, sugarless gum, sugarless candy to keep the saliva flowing, frequent dental visits, biotin mouthwash. Make sure you get make sure you report of any parotid gland swelling or any lump anywhere in the body, any lump in the axilla, in the inguinal area, in the neck, because you want to make sure you rule out any lymphadenopathy due to patients being 40 times more likely to develop lymphoma if they do have Sjogren's.